So whether you are new or old, I want to welcome you here to our meeting today and to the journey that we're all on together. What I just want to do is just provide a very high level overview of what we're doing as a community, why we're trying to build a community-based effort to accomplish our mission, and just focus on the high level of the ways in which we work. You heard a lot actually about the different individual components of the work groups that are actively meeting. So I'm going to provide a kind of a higher level picture that we can then dig into. So first and probably most importantly is to reiterate Odyssey's mission. It's to improve health by empowering a community to collaboratively generate the evidence that promotes better health decisions and better care. And as those of you who attended the symposium heard from George, we take this mission very seriously. We reflect on it often, and we try to reiterate it as regularly as we can. We are trying to build a community. We think that the only way we can actually generate credible evidence is through a community-based effort. And our goal as a community is to generate evidence, to try to actually improve care by generating reliable, actionable information. And so there's lots of components to that, and sometimes it's can be easy to kind of miss the forest from the trees. But make no mistake, this is not a community that is just doing data standards. It's not a community that's just doing open source development. This is not a community that's just doing methods research. This is a community that's goal is to have this community generate reliable evidence to inform better care. And all of those components and all of the individual pieces and all those work groups you hear about are necessary pieces to realize this mission. Our community is growing very quickly and very large. As George shared with you at the State of the Community presentation last week at the symposium, our community is now over 2,500 researchers strong. We've got researchers all around the world. It is important to us that this is a global community. We try very hard to make sure that we have strong representation around the world, and where there's areas of lack of representation, we certainly see those as areas we want to grow. But whether you have a very specific local need to use our data standards or our tools, or you are thinking about international questions, this is a community where you can become part of and contribute in a meaningful way. But our goal collectively is to think about healthcare and public health as an opportunity to generate evidence that can be actionable and meaningful for the entire world. We have activities that are regionally focused, whether that be through our regional chapters, including our European chapter that has a lot of activities that are going on through the Eden Initiative, as well as country-based chapters, as well as through our Asia Pacific community and the country-based chapters throughout that community. So if you are looking for regional opportunities to engage and participate, they are here for you. But this meeting that you're on right now is a place where we try to use this as a global forum to keep conversations going around the world, as well as the forums and the Microsoft Teams environment that Craig's going to walk you through about how we try to manage the fact that we're in 21 time zones right now, trying to work as one community together. The last thing I just want to highlight as an introduction is basically that the way in which we work. So as an open science collaborative, we seek to collaborate together on key strategic areas that are towards our mission of generating reliable evidence to improve care. Those collaborations could be probably organized in these 4 categories. We do develop and evolve open community data standards. And you'll hear about the OMOP Common Data Model in the standardized vocabularies as a key foundation to how we enable community collaboration across our data network. We do open source software development, and this is when we talk about the Odyssey tools. This is focused on the notion that we want to have standard, freely available tools that everybody in the world can actually use that adhere to those open community data standards and enable best practices to be applied to your data. To establish those best practices, we collaborate on methodologic research. It's important that we actually have an empirical basis for making recommendations about best practices on how to conduct studies of clinical characterization, population level effect estimation for safety surveillance or comparative effectiveness, or patient-level prediction work that you heard about from Jenna's paper earlier. And those best practices get codified in this open source development applied to our open community data standards. And then last, but probably most importantly, is our goal is to collaborate on clinical evidence generation. And so how do we generate reliable evidence? Well, it starts by applying the best practices learned in methods research, codified in our open source tools, applied to our open community data standards. And so whether you have an interest in data standards or you have an interest in helping contribute to the development, testing, documentation of programs, analysis code, whether you are interested in methodologic research and establishing and evaluating best practices, or whether you're interested in applying all of that work to answer clinical questions of interest, there's a place and a collaboration for you here in the community. We also, as a community, have a data network. We have the world's largest observational data network. And as George showcased last week in the State of the Community, this is over 330 databases strong, covering over 800 million unique patients, representing over 11% of the world's population. But how does that actually work from a tactical level? In Odyssey, as a data network, we are a distributed data network. What that means is anybody who has access to any observational database can freely agree to participate and be part of our network. It just means that they need to raise their hand and sign up to be part of this community. And the specific steps that they would go through to be part of that network is they would first convert their data from whatever source representation that it currently resides in into a standardized instance of that data set. So basically ETLing the data into the OMOP common data model. They would also agree that they'd be willing to run standardized analytics on that standardized data, and those would be the open source analysis tools that are available in the Odyssey community. Now, importantly, as a distributed data network, we are not sharing patient-level data between institutions. Nobody has to give over their data or get consent from all of the individuals to provide their data to some other organization. Quite the contrary, being part of our data network means your data still remains securely behind your own institutional firewall. All it means is that there's a manner in which you can make use of that data through open community data standards and open source software that makes it possible for you to ask questions within your firewall that can be the same questions that are asked across other institutions. So our data network, when George talks about that there's over 330 databases, what that means is that there's over 330 instances of databases that have gone through a process of converting to the OMOP common data model. And lots of people are on that journey at various stages of that maturity through that journey. But ultimately, anybody who has access to database, whether you're a regional healthcare system, whether you have a particular disease-specific cohort, whether you're sitting at a large insurance company, whether you have a national registry, every database usually starts from the vantage point of believing that their data is a unique snowflake that can't possibly be standardized into a data standard, and then goes through a process in collaboration with others in the community to convert that data into the OMOP common data model. And then what that does is it unlocks the opportunity for you to apply these methodologic best practices and open tools to generate evidence from your data, but also enables the possibility that you can conduct network research. And in Odyssey, what network research means is that as a community, we define pre-specified protocols with analysis specifications of what is the question and how are we going to answer it, applying our best practices. That means that there is actual open source code representing that analysis that can be sent to any willing participant in our data network. The analysis is conducted securely within your own firewall to generate aggregate summary statistics from your patient-level data. And it's those aggregate statistics, no patient-level data, that is then shared centrally as part of a network study. Those summary statistics are compiled together across a network, and then together as a community, we can collaborate to interpret the results and determine the best strategy to disseminate the findings to the broader research community. So whether you're interested in trying to set the standards for data and analytics, whether you're a data partner who is interested in potentially leveraging these tools locally or participating in network studies, or whether you're interested in trying to answer research questions by conducting an Odyssey network study, all of these activities are actively ongoing within our community. And for all of these, there are teams in place that are looking for more collaborators to join us on this journey to generate reliable evidence.